Neurology is a fascinating field that focuses on the study and treatment of disorders affecting the nervous system. Today, we will be exploring the complex world of autoimmune disorders and their impact on the body, with a specific focus on myasthenia gravis. Myasthenia gravis is a neuromuscular disorder characterized by weakness and fatigue of the voluntary muscles, caused by an autoimmune attack on the neuromuscular junction. In this script, we will delve into the anatomy and physiology of the neuromuscular junction, the role of acetylcholine and its receptors in muscle contraction, the immunological basis of myasthenia gravis, its pathophysiology, diagnostic methods, differential diagnosis, therapeutic strategies, management of myasthenic crisis, potential complications, the role of thymectomy, and prognosis and long-term outcomes for patients. Let's embark on this fascinating journey into the intricacies of myasthenia gravis. Autoimmune disorders are conditions in which the immune system mistakenly attacks healthy cells in the body, leading to an array of symptoms and impairments. These disorders occur when the body's immune system fails to recognize its own cells and tissues as self. Instead, it identifies them as foreign invaders and launches an immune response against them. This abnormal immune response can result in tissue destruction, inflammation, and dysfunction. Myasthenia gravis is one such autoimmune disorder, specifically affecting the neuromuscular junction. It is important to understand the mechanisms underlying these disorders to comprehend the pathogenesis of myasthenia gravis fully. The neuromuscular junction is a specialized synapse between a motor neuron and a muscle fiber. It plays a pivotal role in transmitting signals from the nervous system to the muscles, enabling voluntary movement. At the presynaptic terminal, the motor neuron releases a neurotransmitter called acetylcholine. This neurotransmitter diffuses across the synaptic cleft and binds to acetylcholine receptors on the postsynaptic membrane of the muscle fiber. The activation of these receptors triggers a series of events that lead to muscle contraction. Any disruption in this process can result in muscle weakness and fatigue, as seen in myasthenia gravis. Acetylcholine acts as the primary neurotransmitter at the neuromuscular junction, mediating the transmission of signals from motor neurons to the muscle fibers. It binds to nicotinic acetylcholine receptors on the postsynaptic membrane of the muscle fiber, leading to depolarization and the initiation of a muscle action potential. This action potential propagates along the muscle fiber, resulting in the release of calcium ions and subsequent muscle contraction. Any disruption in the availability or functionality of acetylcholine receptors can lead to impaired muscle function, as observed in myasthenia gravis. Myasthenia gravis is an autoimmune disorder characterized by the presence of autoantibodies that target the acetylcholine receptors at the neuromuscular junction. These autoantibodies bind to the receptors, preventing acetylcholine from binding and initiating muscle contraction. Additionally, they activate the complement system, which further damages the neuromuscular junction and impairs muscle function. The production of autoantibodies is believed to result from the breakdown of immune tolerance, leading to an abnormal immune response against self-antigens. The exact triggers for this breakdown of tolerance are still under investigation. The pathophysiology of myasthenia gravis is multifactorial and involves both immune-mediated mechanisms and dysfunction at the neuromuscular junction. The autoimmune attack on the acetylcholine receptors leads to reduced receptor density, impaired transmission of signals, and muscle weakness. Additionally, the complement system activation results in inflammation and further damage to the neuromuscular junction. As the disease progresses, compensatory mechanisms may come into play, including the development of additional acetylcholine receptors. However, these compensatory mechanisms are often insufficient to overcome the autoimmune attack fully. Diagnosing myasthenia gravis can be challenging, as its symptoms can be nonspecific and overlap with other neuromuscular disorders. A thorough clinical evaluation is crucial, including a detailed medical history and physical examination. Several tests can aid in the confirmation of myasthenia gravis, such as the edrophonium test, which involves the administration of a short-acting acetylcholinesterase inhibitor to improve muscle strength temporarily. Other diagnostic tests include electromyography, EMG, which assesses muscle response to electrical stimulation, and blood tests to detect the presence of acetylcholine receptor antibodies. Distinguishing myasthenia gravis from other neuromuscular disorders is essential for proper management and treatment. Conditions that may present with similar symptoms include Lambertian myasthenic syndrome, botulism, and muscular dystrophy. Careful evaluation of the patient's clinical presentation, response to diagnostic tests, and the presence of specific antibodies can help differentiate between these disorders. Electromyography, antibody testing, and in-depth neurophysiological assessments play a crucial role in reaching an accurate diagnosis. The treatment of myasthenia gravis aims to improve muscle strength, reduce symptoms, and prevent exacerbations. Acetylcholinesterase inhibitors, such as pyridostigmine, are commonly used to enhance acetylcholine availability at the neuromuscular junction and improve muscle function. These medications temporarily alleviate muscle weakness but do not modify the underlying autoimmune process. In cases of moderate to severe myasthenia gravis, immunosuppressive agents, such as corticosteroids, azathioprine, or mycophenolate mofetil, may be prescribed to suppress the immune system, reduce autoantibody production, and minimize the autoimmune attack on the neuromuscular junction. Myasthenic crisis is a life-threatening condition characterized by severe muscle weakness that may lead to respiratory failure. Prompt identification and management are crucial to prevent complications and improve patient outcomes. Treatment involves supportive measures such as mechanical ventilation, which assists with breathing, and the administration of intravenous immunoglobulins or plasma exchange to rapidly reduce the levels of autoantibodies and improve neuromuscular transmission. In some cases, thymectomy, removal of the thymus gland, may be considered as a long-term management strategy. Thymoma is a relatively rare tumor of the thymus gland that can occur in individuals with myasthenia gravis. While the relationship between myasthenia gravis and thymoma is not fully understood, it is believed that thymomas may trigger the autoimmune response leading to myasthenia gravis. Thymectomy is often recommended in the presence of thymoma, not only to manage myasthenia gravis but also to remove the tumor and reduce the risk of metastasis. Thymectomy is the surgical removal of the thymus gland and has been shown to improve outcomes in patients with myasthenia gravis. Although the exact mechanisms of its therapeutic effects are not fully understood, thymectomy seems to reduce the production of autoantibodies and modify the underlying autoimmune response. Patients who undergo thymectomy often experience a reduction in symptoms and a decreased need for medication. Thymectomy is typically recommended for younger patients, before they reach middle age, as it is believed to be more effective in these individuals. The prognosis of myasthenia gravis varies, with some individuals experiencing mild symptoms and others having more severe and persistent weakness. With modern advancements in diagnosis and treatment, most patients with myasthenia gravis can achieve a good quality of life and have near normal life expectancy. However, the disease may require lifelong management, and periodic exacerbations or complications can occur. Long-term outcomes greatly depend on proper medication management, compliance with treatment, and regular follow-up care. In conclusion, myasthenia gravis is a complex autoimmune disorder that affects the neuromuscular junction, leading to muscle weakness and fatigue. Understanding the intricate interplay between immune dysfunction, acetylcholine receptors, and muscle physiology is crucial for accurate diagnosis and effective management. While the disease poses challenges, advancements in diagnostic methods, therapeutic strategies, and surgical interventions have significantly improved outcomes for patients with myasthenia gravis. As medical professionals, it is essential to stay updated on the latest research and continue exploring innovative approaches to enhance the understanding and treatment of this fascinating disorder.